This is the All About Hearing series from the Early Years Project. Throughout our videos, we use QR codes to direct you to different resources. In order to access the resource with the QR code, pause the video when the QR code appears, and then on a different device, open the camera and point the camera at the QR code like you're taking a picture. A link will pop up and it will bring you to the resource. If that didn't work, you can try holding your device steady or get closer to the screen. If you need to access the QR code from the device that you are watching this video on, you can take a screenshot when the QR code appears in this video. And then later on, you can open the photo gallery to find the screenshot. Just tap or hold the QR code and the link to the resource should populate. Hearing loss, prevalence, and risk factors. Hearing loss is one of the most common birth defects. More than 90% of deaf children are born to hearing parents. About 3 in 1,000 newborns have a congenital hearing loss. 5 in 1,000 children ages 3 to 17 years were found to have a hearing loss in the CDC's National Health Interview Survey from 1997 to 2005. By 2005, most states had established a statewide EDI, Early Hearing Detection and Intervention Program. This was supported by funding and guidance from the Centers for Disease Control and Prevention, or the CDC, and the Health Resources and Services Administration, or HRSA. These programs helped hospitals and pediatricians track and follow up with infants who didn't pass their newborn hearing screenings. Over 98% of newborns receive the newborn hearing screening. In Illinois, 2.4 out of 1,000 babies screened have hearing loss, where the national average is 1.8 children out of 1,000. Risk factors for hearing loss. Hearing loss in babies and young children can be caused by different risk factors. Some happen before or during birth. This is known as congenital, while others happen after birth. This is known as acquired. Here are some common examples. Congenital risk factors. So, a big part of this is genetic factors. Hearing loss can be inherited even with no family history. Some genes affect only hearing, while others are part of syndromes like Usher or Waardenburg syndrome. Infections during pregnancy. Infections like the cytomegalovirus CMV, rubella, toxoplasmosis, syphilis, or herpes can all affect fetal hearing development. Structural differences. Sometimes parts of the ear don't develop as expected before birth. This can affect the outer ear, the middle ear, or the inner ear, and can lead to hearing loss. A missing or underdeveloped ear canal, abnormal ear bones that don't move properly, inner ear structures that are shaped differently or are incomplete, and these can all vary in severity. Exposure to ototoxic, harmful to the ears, substances. Certain medications taken by the mother during pregnancy, like some antibiotics or chemotherapy drugs, can affect an unborn child's hearing. Then there are perinatal causes. That means during birth. So, premature birth. Babies that are born before 37 weeks are at a higher risk for hearing loss, especially if they need intensive care or ventilators. Babies that are born with a low birth weight, 3.3 pounds or less, increases the risk. Birth complications. Lack of oxygen, known as hypoxia, Severe jaundice, known as hyperbilirubinemia, or an extended NICU stay can all be contributing factors. Also, use of ototoxic drugs, medicines used in neonatal care, such as certain antibiotics, aminoglycoside, or loop diuretics. Those may cause hearing damage. Acquired risk factors, otherwise known as postnatal risk factors. These develop after the baby is born. Infections. Infections like meningitis, measles, mumps, chickenpox, CCMV, congenital cytomegalovirus, influenza B, or sepsis. Head trauma. Any significant injury to the head can affect hearing, tear, or puncture the eardrum. Chronic ear conditions. Fluid buildup or persistent ear infections can cause a conductive hearing loss. Impacted wax or foreign object in the ear. Noise exposure. Loud or prolonged sounds, even in early childhood, can damage hearing. Delayed speech or language development. Sometimes these can be a sign that hearing loss may be present. Other considerations. Family history of hearing loss should always be a red flag, even if the child seems fine at birth. Newborn hearing screening is crucial. It's a good starting point, but some types of hearing loss develop later on in childhood. Syndromes associated with hearing loss sometimes present with vision problems, developmental delays, or balance issues. One of the most important things for families to know, whether you suspect a hearing loss in your child or one has been diagnosed, is that you are not alone. In Illinois, you can connect with caring parent-to-parent support through our Illinois Hands and Voices Guide by Your Side GBYS program for free. These are parents who have walked a similar path and are here to listen, support, and guide you. If you have any concerns about your child's development, consider reaching out to your pediatrician, audiologist, early intervention specialist, or developmental pediatrician for guidance and support. Even if your child passes a hearing screening, it doesn't guarantee perfect hearing for life. It's still important to keep an eye on developmental milestones and speak up if new concerns arise. Early action makes a big difference. The Early Years Project was brought to you by Illinois EDI Early Hearing Detection and Intervention Program and Illinois Hands and Voices Guide by Your Side. Please take a moment to take our brief survey. Parents, please use the QR code to the left, and providers, please use the QR code to the right. Thank you so much.